Another important descriptor of murmurs is the location on the patient's chest where the murmur is heard best or loudest. And that information is shown on this slide, and this is super high yield for the Step 1 exam because they're going to describe to you the locations on the chest where the murmur is heard loudest, and that's going to be an important clue as to what's causing the murmur. So let's start with this point labeled A, which is sometimes called the aortic projection area. This is the second intercostal space at the right upper sternal border here, and this is where you hear the murmur of aortic stenosis the best. And aortic stenosis is a very common murmur that you will hear in clinical practice. On the left side of the chest, the second intercostal space at the left upper sternal border, this is where you hear pulmonic murmurs, like flow murmurs of blood moving past the pulmonic valve, or pulmonic stenosis or regurgitation. It's also where you can hear the murmur of a patent ductus arteriosus in a baby the loudest. If you go one interspace down to the third intercostal space at the left sternal border, this is a position called Erb's point, and that's where you hear aortic regurgitation the loudest. Aortic regurgitation is usually heard loudest in a different location than aortic stenosis. Make sure you keep that straight. And then Erb's point is also where you hear the murmur of hypertrophic cardiomyopathy the loudest. Down here we have the fifth intercostal space at the left lower sternal border, and this is where you hear murmurs from tricuspid valve disorders loudest and also murmurs of a ventricular septal defect. And then finally, if you go to the fifth intercostal space and you move out to what's called the mid-clavicular line, meaning the line in the middle of the clavicle up here at the top, that's the mitral projection area. That's where you hear mitral murmurs the loudest. This is also the apex or point of the left ventricle. You can feel this with your hand, and in a normal patient with a normal heart, that's usually also felt at the mitral projection area, meaning the fifth intercostal space at the mid-clavicular line.